Good morning, everyone, and thank you for joining us. Today, we're going to be talking about chronic fatigue syndrome. And I want to start off by saying this is another challenging diagnosis for us in the sense that it is very frustrating for my patients, and we don't have a lot of great treatment options yet. And it's really hard uh, to know that I'm just trying to encourage you to continue. And we'll talk about some treatment options. And I will, I will say there's some encouraging data, but I recognize this is a frustrating diagnosis for a lot of you who do suffer with chronic fatigue. So with that said, let's go ahead and get started. So chronic fatigue syndrome, it's also known as myalgic encephalomyelitis, chronic fatigue syndrome. It is an illness of uncertain cause. We do not know what's causing it. Lots of studies have gone into the central and the autonomic nervous system, as well as the immune system, metabolism. But to date, we don't really know what is the driving cause of chronic fatigue syndrome. The presenting complaint is simply that fatigue. I'm feeling tired. I don't understand why. It's kind of a diffused fatigue throughout the entire body. It's not focused anywhere. Prevalence is uncertain. Some studies that they have done, both in the United States, the UK, India, Asia, put it somewhere between prevalence of around 10 to even 25% of patients who suffer from chronic fatigue. So highly variable, very uncertain as to like the actual prevalence that we're dealing with. The disorder does seem to primarily affect young and middle-aged adults. However, that's not exclusive. It also seems to be more common in females than males, but again, not exclusive. I feel like in my practice, I see as many men and women, as many old, middle-aged, and young individuals who are suffering from this. So I'm just sharing with you some of the data that I found. The symptoms, however, need to be present for at least 6 months. And what you will have is a general fatigue. Other common complaints are post-exertional malaise. So you work out, you feel tired for 24 plus hours, like an extreme fatigue. You wake up unrefreshed from sleep. You have cognitive impairment. Maybe your memory is just not as sharp as you are. You just kind of feel spacey. And then otherwise, again, just a general fatigue and tired feeling. Just as the prevalence is uncertain, the pathophysiology is uncertain as well. Lots of energy and effort has gone into figuring out what is the underlying cause, and we just don't know. They've looked at virology, immune dysfunction, endocrine dysfunction, metabolism dysfunction, neuropsychiatric dysfunction. But at this point, we don't have a good understanding of the pathophysiology for chronic fatigue syndrome. It is also not homogeneous. So you will get multiple different presentations surrounding a general fatigue. And there are important things that have to be present, but not everyone is going to also have memory problems. Not everyone is also going to wake up unrefreshed from sleep. Just about everyone's going to be fatigued. I mean, that is in the name. So that is the one unifying factor. But the clinical features that we expect to see can be sudden or gradual. And again, like I said, at least 6 months worth of this. The fatigue can be associated with worsened sleep patterns. You sleep too much, you sleep too little. Cognitive deficits, your memory's off, you just feel spaced, like you're not able to focus as well. You can have the symptoms exacerbated by physical activity, like we talked about the post-exertional malaise. And it's also almost, it is also important that it is found in individuals that are otherwise healthy. And we'll talk about that. But chronic fatigue syndrome is a diagnosis of exclusion. And we want to make sure that we're not attributing this to something else that could be addressed, whether it's an electrolyte abnormality or a thyroid abnormality. So it is a diagnosis of exclusion. But that having been said, it can be frustrating because you're like, well, there's nothing, all the tests are normal and what's going on? And I understand that that's where it gets very frustrating. And again, physical exam, it's normal. Now, you can have patients who feel febrile, but then they'll take their temperature and it's never elevated. You'll have patients who complain of arthralgia, like joint pain in the shoulders and the elbows and the knees and the hips, and it can be migratory. So sometimes it's the shoulders, sometimes it's the knees, and it doesn't seem consistent. You do the examination, you realize there's no swelling, there's no tenderness, there's no physical abnormalities, but there's pain. Muscles are fatigued easily. And yet when they do muscle studies, they realize there is no myopathy. They have patients often will complain of cervical lymph pain. Sometimes it'll be in the front, sometimes it's axillary. And it is more common in the cervical lymph nodes. But when they've done studies, looked at the lymph nodes, there's never any lymphadenopathy or lymphadenitis or anything dangerous. And yet it is plaguing these people. And the frustrating thing is that this fatigue can be very disabling to patients. And what they have found is that the patients often get frustrated with themselves because the physical exam is normal, the laboratory tests are normal, but the studies are not giving any explanation. Oftentimes they have trouble explaining this to friends and family, and so they feel somewhat isolated, and it's very frustrating to them and difficult for them dealing with this fatigue when there is no real explanation, and even the science isn't helping because we can't tell you why it's happening yet. We talked about this as a diagnosis of exclusion, and I do think that this is important. And I want to make sure that when we're evaluating you, that you know that we've got to make sure that your labs are normal. So things like your complete blood count, your chemistry panel, including your electrolytes, calcium levels, renal and hepatic function. We need thyroid studies, and also creatinine kinase, which is like a sort of a muscle enzyme that we want to evaluate. All these things need to be normal. Again, you can still have chronic fatigue with those, but if you have abnormalities in the labs that we can address, we want to address that first, because if that solves the problem, A, you'll feel better, which is great, and B, it does not meet the criteria for chronic fatigue. Important, there is no routine necessity for any kind of a neuroimaging. Now, there are obviously, everyone's individualized. You need to talk to your provider about that, but there's not a routine necessity in chronic fatigue for any kind of a neuroimaging. Now, if you have other symptoms, obviously address that with your provider and make sure that there's no need for that. But that is something that, I want to talk about as well. Therapies, many different therapies have been tried. There is no tried and true therapy that has been found. I would say that management needs to be supportive, that the care that we can provide to you needs to address the symptoms and try to do the best that we can to help with sleep and any other comorbid problems, whether it's depression and anxiety or other medical problems that can be addressed. Physical activity is also important. Now, we talked earlier about this post-exertional malaise, so that makes it kind of challenging because you're like, well, okay, that sounds great, exercise, and then I'm spent for the next 24 hours. Physical exercise, it needs to be tailored to the individual. So I always kind of joke, like, I don't want you necessarily to start training for a marathon, but I want you to stay physically active. And it does show some promise in the literature that it will help address the underlying symptoms of chronic fatigue. Now, you gotta tailor it to yourself. So you gotta kind of figure out, and you may have to sort of test as you go along. Like, that was too much yesterday. I need to back off a little bit and find sort of that sweet spot where you can stay physically active, because it will help you. Diet is also important, but there's not a specific diet that's been identified or proven in the literature that says, hey, this is the diet for people who have chronic fatigue. You're just going to have to kind of try. And it is hard. It is frustrating. And I definitely understand that from that standpoint, because unfortunately, there's not a straight therapy that I can offer you, which makes it really difficult for me on the provider side to say, hey, look, if you just do this, you're going to feel great. We just don't know yet, unfortunately. Now, there is a little bit of good news. And what I will tell you is that the studies are not optimistic on a short-term basis. So on that functional recovery, that fatigue that you're going to feel within the short term, it's going to could be pretty severe. Long term, however, much more positive. So the long-term prognosis appears to be better. The studies are still ongoing, but what they're finding is that as the disease progresses, my suspicion is patients figure out how to better cope with it, whether diet and exercise, sleep studies, managing other medical problems, those types of things, that they manage it better on a long-term basis. So it does appear to have a more optimistic long-term prognosis. The other optimistic thing is that chronic fatigue syndrome is not associated with any increased risk of all-cause morbidity or mortality. So there is no increased risk for overall mortality with persons who have that. Now, sadly, there is an increased risk of suicide. So if you are feeling depressed, certainly reach out to your provider, or if you need more immediate help, call 911. But long-term, the prognosis does appear to be more optimistic. And that's encouraging. And I think that's where I want to leave you, is with an encouraging message that though this disease state is very frustrating because I don't have any definitive treatment options for you, I do want you to be encouraged to persevere as best you can, continue to work through all the challenges of the fatigue, try not to give up on figuring out an exercise plan, figuring out a diet plan, figuring out if there are cognitive behavioral therapy techniques that you can employ. Don't give up on trying to figure out how you can best optimize your life with this, because it is very challenging. And I understand that. And hopefully we'll have some better treatment modalities in the future. But it does appear that long-term prognosis is better. Unfortunately, short-term, it's not. But I do want to encourage you to continue to try to persevere and work through that. And if you're having the need to reach out to specialists, do that. And certainly want you to be able to persevere through this, because I know it's a very challenging and can be a very debilitating disease state. So with that, I'm going to open up to questions, and we'll try to post a lot of that information so you can go back and refer to it. But I'm going to stop talking and see if I can answer any questions for y'all at this time. I would say the question is chronic fatigue a common condition among veterans? I would say yes. My experience is going to be skewed because I do see a lot of veterans with chronic fatigue. So I would say, though, that looking at the veterans that I see with the studies that I referred to, I would say 10 to 20% of the veteran population fitting in with the population studies. But to me, 10% is common. I mean, that's not, certainly 20%. So yeah, I would say it is fairly common. So the question about providing other evidence or diagnosis when going into an appointment, the important thing for us on the telemedicine side is that you've had lab work done that basically shows that there aren't the electrolyte abnormalities, your complete blood count. So because let's say your blood levels are low. So if you're anemic, that can make you really fatigued. So we need to see the lab work that's normal. We need to see the thyroid that's normal, the creatine kinase that's normal, the chemistry and the blood counts. That information needs to be normal. We do not need any neuroimaging. Obviously, when we're talking to you, we'll get an idea, what other past medical history do you have? And we'll want to talk through that. But as far as any lab work, the complete blood count, the chemistry panel that would include the electrolytes, the calcium, the renal function and hepatic function, the thyroid panel, and the creatine kinase. And again, that's information that we can post, so y'all don't have to remember that. So the best way to get a diagnosis from Telemedica is to reach out to our website, which we'll put below, as well as we'll give you a phone number to call to work on setting up an appointment for an evaluation. And this is one of the situations where it is beneficial to have that lab work. If you don't, we can still evaluate you. Now, we're going to refer you to, hey, look, go get some lab work. We need to make sure that we retouch base and make sure everything's normal. But if you have that lab work, set up the appointment, reach out to telemedicallc.com. They'll work on getting you set up with one of our providers to get you evaluated. And once you have that lab work and we can review that, we can talk to you and do a history. And like I said, most of what we need is a fairly limited physical exam. We can talk through most of it. But the physical exam on patients with chronic fatigue is normal. And so we'll want to just be able to evaluate you and talk to you. So work on, just reach out to Telemedica and they'll work on getting you set up with one of our providers to get you evaluated. Yes, chronic fatigue, Gulf War syndrome, and fibromyalgia have a lot of overlap. And the difference, so the Gulf War syndrome is going to be of significance for my Nexus letter team. So I'm going to defer that to them. But patients with the Gulf War syndrome are going to have the chronic fatigue. The fibromyalgia is, in my experience, more pain related, whereas chronic fatigue is more fatigue related. So oftentimes I will have patients with both. You can have both, but oftentimes I'll also have patients who have chronic fatigue and they're not really complaining of pain, except maybe like we talked about the migratory joint pain. But fibromyalgia is more of a my thighs hurt, my hips hurt, my muscle pain. And not all patients with chronic fatigue are complaining of pain outside of the migratory joint pain. And not all patients with chronic fatigue have migratory joint pain. Like I said, the real unifying factor is that fatigue, that feeling of just gross tiredness throughout. Some patients have that feeling of, gosh, I really feel hot. And they take their temperature, they don't have a fever. Some patients have the tender cervical lymph nodes or axillary lymph nodes. Some do not, but the fatigue is the unifying factor. The fibromyalgia, on the other hand, that's a much more, their unifying factor is the pain, and it's a muscle pain. Hopefully that helps. So as far as a medical specialist, a primary physician is capable of diagnosing chronic fatigue. You would need that lab work. So again, chronic fatigue being a diagnosis of exclusion, you don't necessarily need a specialist, but you do need someone who's capable of doing lab work to rule out other disease states that could be addressed, whether it's anemia or thyroid disorder. Those are two that come to mind. And then as far as a Nexus letter, we'll get you set up with one of our Nexus letter writers on our Nexus letter team so they can help you. But we have providers who are capable of diagnosing chronic fatigue, as well as a Nexus letter team that can work on your Nexus letter. Well, if we don't have any other questions, hopefully that means that I was thorough. But again, we will post this information so that you can refer back to it. Please don't hesitate to reach out with questions. Certainly, if you've been having 6 months or greater of fatigue, reach out to Telemedica. Work on getting an appointment to be evaluated, because it is something that I think would help at least give you some explanation as to, hey, this is at least why I'm feeling tired. And although we don't have great treatment modalities, again, I want to be as encouraging as I can that long-term, this does have a better prognosis. Doesn't mean that this is going to be easy, but we want to do everything we can to help you. And the first step is working on getting you a diagnosis. So with that, I'm going to close out and wish everyone well. And thank you for joining us. I appreciate your time. And I hope everyone enters into a great summer. Thank you.